one of the things that we were hoping to, or are planning to implement with these is the bedside barcode administration, barcode scanning for medication administration, which is actually a federally mandated change that occurred in healthcare. All acute care hospitals had to go to barcode scanning for safety purposes.
Okay.
And currently, in all of our simulations and competency environments, medication administration is documented paper pencil. And faculty's finding out that even within those settings, there are medication administration errors, which really augments the fact that the barcode scanning was implemented for patient safety. The other thing the cost to the department or from the grant is just for the actual hardware. All the software is a student paid expense as like a textbook would be, and they just get login access code with their when they purchase that. So this is an Elsevier product. So the students would log in. Here's the software. And then this is the simulated electronic health record that would come up. This is actually going to have objectives for what we want them to gain from the experience. And right now I have loaded in essentially the rubric that their care plans will be graded on. And then they just click to start the assignment. The first day of their clinical, so whatever day they're in the hospital or in simulation or doing their competency. Patient identifier, it doesn't have to be the first and last initial of the patient. I told them they could use my initials to protect patient privacy. Right now we're just doing this in the medical surgical areas. The gender of the patient, age. It does make you pick an avatar. There's no getting around that. And then the student's first and last initial. And then they'll put their credentials, which would be student nurse. And now the chart's opened up. So this is where, this preclinical manager is where they do some of their pre-work, and that's a perfect name for it. They can type in a medical diagnosis, and then as part of their assignment, they have to explain the pathophysiology, what the therapeutic regimen for treating that is, so physician's orders, diagnostic testing, and then current health problems related to what the diagnosis is, like if they just had a knee replacement and they're no longer able to put their socks on but without assistance. That would be a current health problem or functional change. And you have a new medication. Let's pretend I've never heard of acetaminophen before, otherwise known as Tylenol. If this is the first time I'd come across Tylenol, I click this button here, and it takes me to a drug monograph. So this teaches them what resources they have available to them in practice. And my most recent practice area, same thing. I'd have a diabetes medication come up that I'd never heard before. I'd be able to click on it. The monograph would come up. I'd know what to look for in terms of adverse effects and educate myself on why a person was taking that medication.
Yeah.
So in the simulated environment or in the competency evaluation environment, some of the pre-work the instructors can do is to print a identification bracelet for the patient and then print the actual barcodes for the medications the students will be administering, place them on a pill bottle. And then the students would actually, as part of their medication administration record, then barcode scan the patient's wristband and then barcode scan the medication just like they would do in the hospital environment. That's what's done in practice to ensure medication safety.